Welcome friends. I hope you have liked our India First Leadership Talk series. To watch our other interesting videos, you can look at my timeline on my Twitter handle, Abhay Jere. I really request you to share these videos with your friends, family and colleagues. So now moving forward, today we have with us another interesting guest who is a renowned Indian Ayurvedic physician. In 2017, Government of India appointed him as Secretary of Ayush Ministry. Undoubtedly, he is Padma Shri Vaidya Rajesh Kotecha. Kotecha sir, welcome to the discussion.
Namaskar.
So sir, currently as you see, when we are watching TV or when we see newspaper, there are a lot of advertisements, claims by many practitioners, Ayurveda practitioners, Babas, claiming that they have cure for COVID-19 infection. So sir, how you are managing these claims and whether Ministry of Ayush actually is validating it and supporting these claims?
Actually, you know what? First of all, nobody should claim that is the truth, that nobody should claim, because this is a new entity, new virus, and the behavior of this virus and its pathogenesis is still being studied. So how can anybody claim cure? So we have requested through our social medias and through our channels to all these people not to claim. If you look at people's perspective, then you know there are I'm not justifying, but there are so many historical reasons about claiming so many people that I have found the cure, because in our country we have plural health system, and then it is kind of very democratic that people from the grassroots, the traditional healers and the people who is living in jungles, from those people to the renowned physicians, there are so many levels of practitioners, and in public domain everybody understands they are the same. It is not true. So you can see that the claims are coming from this fraternity who have no qualification most of the time, and they just claim. So it should not be accepted, because it creates a kind of a comfort in people's mindset that if we do this, we'll be cured. It is not true. And anyway, these people have never seen any COVID patients, so how they can claim cure? So these are the questions on their claims. So we have notified a formal government order from Ministry of Ayush recently, indicating states to curb this and file FIR against all such claims, and it should not be tolerated, because as per this the Home Minister's notification, this is a notified pandemic disease, and such claims are punishable offense. So this is one thing we did, and you can see that in last 2 weeks, all these claims are suddenly stopped or minimized. It's because of this threat of action against those kind of claims. The other thing is that a lot of people are claiming on social media and on Twitter and Instagram, and they are actually advertising that okay, we can cure. And some Babas also says, I have few Babas called me that you put me in corona ward and I take this risk and I will cure everybody in 24 hours. These types of big claims should be prevented and should be checked. So we have also we are working with SCI, we are working with Press Council of India. We have also written letters to the states that this advertisement should be stopped. So it has a positive impact. You can see it in print media particularly, and in electronic media. Such advertisement with claims have been stopped. So this is another thing. Third thing is that if somebody says that I have something with immunity promotion without relating it with COVID, that should be fine, because Government of India has also advised and issued an advisory in which we are supporting the idea of improving individuals' immunity through home care, through self-care, through a lot of modalities like that.
But sir, some of the people might certainly have some real good ideas or maybe even some real good formulations. And systematic studies need to be conducted on those formulations. So whether you are taking any steps in that direction to promote these studies in systematic fashion?
Actually, there are a lot of things happening, being happened. Uh, uh, you may be aware that in the last week of March, Honorable Prime Minister had a video conference with the stakeholders, Ayush stakeholders. He spoke with the leaders of entire country, includes industries, including practitioners, including academia, including research, and it has a great impact because Honorable Prime Minister said that such claims should be prevented. At the same time, if there is a possibility of real good solution, it should be explored and evidence may be generated. So, so this is a clear message to the leadership of Ayush that you should do this. And immediately as a follow-up of this, already we did initiate, but after the Honorable Prime Minister's this confirmation on and the instruction on doing this, we have created a interdisciplinary task force, and this task force is chaired by Professor Bhushan Patwardhanji. He has no need of introduction. He is a very eminent scientist. He was the director of Interdisciplinary School of Integrative Medicine in Pune. He had been vice chancellor of a couple of universities. Now he is UGC vice chancellor. He is a renowned researcher. He had a lot of publication on his credit, and there is no question about his ability. He is a basic science specialist. So under his leadership, we have appointed 17 such experts from across the country, including representative of ICMR, Department of Biotechnology, CSIR, and that has given a good impetus. But we have also created mechanism. Looking at your question, you said a lot of people may have a lot of ideas. We were also getting a lot of such suggestions by email, by phone call, and it is true that people should have such big country. If we should explore all the possibilities, so we have created a system to channelize such ideas and proposals from across the country. So we have created a crowdsourced platform at our website, Ayush website. That is accessible at our website. One can go to homepage and there is a link. Otherwise, you can just type Ayush COVID-19 and you can go to that web page where we are inviting such proposals, such ideas. And if somebody is having more like PDF files and want to submit more, then there is an email address which they can send by email also. So you won't believe, but in less than 2 weeks time, we have received 2,500 plus suggestions and proposals from across the country. And then we have created a mechanism to screen these and to take scientific proposals out of it and then to decide which should get priority. We get a lot of proposals from practitioners about their insight, and I would like to mention here that these Ayush sciences, Ayurveda, Unani, Siddha, homeopathy, all these sciences have this wisdom of experience of dealing with such situation. That is an advantage. That this type of pandemic, of course, nobody should tell them, oh, we know about this pandemic, but such kind of illnesses, flu-like illnesses, respiratory problems, without claiming cure, if a physician is given a patient, they can help for respiratory system, they can help for immunity, like that. So those kind of suggestions we have received a lot, and there are some serious scientific proposals also based on evidences and research publications. So all research councils have been sensitized. We have research councils for all the Ayush systems, Ayurveda, Unani, Siddha, homeopathy, yoga, naturopathy. So we have given the respective proposals to those councils. They have created a group of scientists as a screening committee. This screening committee is working 24/7 and they finalize and recommending which proposals should be taken forward and which proposals needs to be taken later or which proposals is not feasible. And then we have developed the mechanism of replying also to them that we have received your proposal, but because of this and this reason, it cannot be taken forward. So there is a two-way mechanism and not only one-way mechanism, so that people should know what is going on. Now last thing that these proposals are given to the task force. A task force is vetting which should be taken forward. I'm happy to mention the task force have proactively identified 4 such candidates, and CSIR also is happy to work with us, and we are at the stage of beginning, finalizing and like declaring these 4 studies in next 2 days. So this is the outcome of such Herculean exercise of less than 2 weeks.
Sir, whenever you talk to these Ayush practitioners or alternate practitioners, they always talk about faith-based evidence, or because of their faith. They don't talk about evidence-based studies. You know, they are not keen on getting into clinical trials, double-blind trials, those kind of things. So, sir, what Ministry of Ayush is actually doing to push these practitioners on doing evidence-based studies, sir?
Actually, you know, these kind of statement what you did is usually Ayush people would hear. It is kind of because of lot of ignorance also from the other side of the people who is not very much versed about Ayush. So I have a little objection, a protest about your statement that this is an alternate medicine. This is not alternate medicine. It's a mainstream medicine being practiced since few thousand years. It's not faith-based medicine either. There is science inside, and who is claimed with faith, they are not trained. Who is trained in this system, having registration, university-based education, they don't claim. The claim is the people who don't know this. So there is a difference between, you know, those, both of them should not be, you know, stated together.
True, sir. True, sir.
First thing.
I agree with you.
And this happens into the, you know, all health systems. The other thing is that you know, there are in the science also, evidences have a lot of different criteria. You know, it is fashionable to state double-blind, RCT, gold standard studies. But if you go to PubMed and if you see a lot of the meta-analysis, you can see that this RCT's gold standard is also now outdated. And you know, it is interesting to know also that more than 50% of such RCTs, the outcome is not reproducible.
Agreed.
So we should think more holistically where science is in. And I have another statement that these sciences, basic sciences particularly, are the inventors, not the medicine people. So expectation from Ayush people should be little you know, minimized. That they are there to practice, they are there to take the science forward. The validation task should be done by the basic science people, like in allopathic system it is done. In allopathic system, the allopathic doctors are not doing research, they are practicing it. The evidence is for them is being generated by the basic science people. So that is what is the model should be, and that is what we are also doing. We have roped in a lot of basic science into our system, and then there are a lot of evidences. I would like to invite you and the listener of this program, this small interaction, to go to type on Google Ayush research portal. This portal we are hosting on our CCRA's website, and there are more than 25,000 indexed journal publications.
Right.
And one can go in a searchable format. So if you want to see on Haldi how many papers are there or whatever, you know, so there are evidences. We the other systems of the scientists and public at large should look at those evidences. So this fraternity, Ayush fraternity is now no more ready to hear this, that oh, you people should generate evidences and how long you will practice faith-based healing. It is not true. And there's another thing that is also interesting, that if something is experiential, like ashwagandha is being practiced since 1,000 years. Yeah, so people are taking this medicine since 1,000 years.
Or Shatavari.
Or Shatavari, or there are so many. Good, see, there are so many. So these experiential the evidences have a lot of value. So that they should not be subjected to the same kind of rigorous kind of, you know, safety studies and animal trials and, you know, kind of standardized this and that. So we have also, you know, in regulation also there are provisions that these medicines can be directly taken to the clinical studies, and that route is actually facilitating a lot of evidence generation. And there are a lot of works going on. There is a lot of things already happened. So I want to clear this, you know, the cloud about this area. So I talk a little bit more. So sorry, I apologize for that, but
no. You should clear it, sir, because this clarity needs to be there.
Yes.
So, sir, currently during this COVID crisis, large number of these COVID warriors, what we are calling them, are on streets. They are working really day and night to ensure that our patients, our citizens get maximum benefit. They are reached to. So, sir, when it comes to Ayurvedic practitioners, sir, how you are training these Ayurvedic warriors to fight this COVID crisis, sir?
It is interesting that all Ayush workforce, is on board to deal with this crisis. If you are aware, Government of India have created 11 empowered groups to facilitate the dealing with the crisis, and one of the group is about human resource and capacity building.
Right.
And fortunately, Ministry of Ayush is on board for this particular group. I am the member of that group. So what we did, that we have worked with AIIMS and we have created specific training modules. Dr. Guleria, the director of AIIMS, and his team have created a specific training module for Ayush workforce. And there are different categories of Ayush workforce. So Ayush practitioners, all Ayurveda, Unani, Siddha, homeopathy practitioners, and the students, the PG students, the UG students.
And how many such practitioners are there currently working, sir?
We have trained 300,000 people.
So about 3 lakh people.
Yes. And the deployment is about 50,000, and the remaining they are all ready to contribute whenever they are called. So, and it is a development of only less than 10 days, in 10 दिन में हो गया.
So on one part, you have human resources. On other part, we also require large number of hospitals and beds to take care of these patients. So, sir, whether even Ministry of Ayush is trying to push hospitals which are dedicated towards Ayush or homeopath to actually help corona patients?
It is already done actually. So we have roped in, we have 750 education institutions across the country. So we have already provided the data of our willingness of so many such education institutions that if needed, they can be immediately converted into exclusive corona facilities.
Okay.
So we are ready for any such crisis, let's hope. And by God's grace, it seems that we will not need all those preparedness, but we are ready.
So if you really look at this COVID pandemic and compare morbidity and mortality across different states in India, then you will see that in some states there is very high mortality morbidity, while in some states there is very low morbidity and mortality. Whether Ministry of Ayush is looking at the differences, why this pattern is emerging, whether there is any difference between their diet or their immunity and these kind of things?
Actually, you will be happy to know that we are on it. If you remember the other day, 3 days before, when our Honorable Prime Minister spoke with the entire country in his nationwide address, he mentioned about Saptapadi, 7 steps he would expect from the...
he talked about holistic approach also, yes.
He talked about holistic and integrative approach. He also talked about the following the Ayush guidelines for
guidelines.
So what we are doing, that we all know that whether it is dictated by an Ayush practitioner or by IC activity of state governments or central government or by wisdom of the home, we are doing something to prevent ourselves, to improve our immunity. Somebody is taking some kadha, somebody is taking some homeopathy medicine, somebody is talking with their healer and then doing what they are suggesting. So what we want to do is that we are trying to capture this data. What is being done by a large sample size, say 5 million or 10 million, so that we can infer what is happening. This question, the answer of this question is not, I can answer by hypothetical replies, but I should not be hypothetical. I should have precise and specific reply. So we also want to find out the solution or the answer of this question. That is why we are initiating these large scale studies across the country. There's another clue we found, that in these guidelines we have recommended to take Chyawanprash.
Yes, sir.
And we have found that the consumption of Chyawanprash is different in different states. And consumption in the terms of regular purchasing and quantity is different. So we have found that the people of the states where Chyawanprash is more consumed, they have less mortality and less morbidity. So we are trying to connect this data with this inference but it will take some time to take this to some conclusion and some publication. But what I'm trying to convey is that there are traditional practices which is inbuilt in our behavior. So the people in such some states it is very prevalent, and by and large they are prevented from complications. And in some countries, in some states, we are more westernized, and we are not following these traditional practices of eating right and sleeping right and those kind of things, simple things. And then we have more morbidities in those states like diabetes and hypertension. So when there is a more morbidity along with this disease, there is more mortality. So
Yes.
we'll find this answer. But by and large, when you compare with the other countries, it's interesting that in our country, having population of 135 crores, like 1.35 billion, the numbers are too less, and it is hard to believe. The world media is looking at us. They are usually biased, and they always criticize our country's different kind of happenings. But for them, it is no less than a surprise that why the so-called big developed countries are having big mortalities and big numbers, and why in our country it is less. Of course, it is because of the government's proactive measures. It is absolutely true. But there is a possibility that we may have an inbuilt immunity because of our behavior, by and large, in our spices, in our home remedies, and that also is contributing. So we'll find out this answer by this large-scale study.
You talked about spices, you talked about our home remedies, and sir, in your immunity guidelines which you have prescribed, you have talked about it a lot, and actually you have prescribed formulations or kadhas which could be made at home using these spices, sir. So would you like to elaborate on that, because it will be very, very relevant for our viewers?
First of all, I would like to mention that these self-help guidelines for immunity promotion are so simple that it is hard to believe. But it's backed with the traditional practices and as well as scientific publications. So for all these, there are more than 125 publications, which I am mentioning now. First of all, we have advised the people to drink warm water as much as possible. So in place of cold water, warm water. This is one thing. Another thing, we have advised the people to use certain spices more at home, like haldi and jeera and dhania and salt and lasan, like garlic and all those things. And these individual spices have a lot of antiviral effect, lot of anti-inflammatory effect, and that they are all supportive to respiratory system. So this is another, one of the guidelines. We have also suggested to apply ghee or sesame oil or coconut oil into nostrils like this. Of course, you wash your hands first and then apply and then wash your hand again. But this application of oil in nostrils creates, a kind of a mechanical barrier for entry points, and foreign bodies cannot penetrate into our epithelial layers.
Right.
And there are studies available about that. So it is so simple. And then we also advise the Kavala Dharana. Kavala Dharana is this application of oil is known as Pratimarshanasya in Ayurveda.
Okay.
And Kavala Dharana is oil pulling therapy, in which one should put an oil into 1 spoon of any oil, maybe coconut oil or again sesame oil, and then put in the mouth. Don't drink, don't take it to the throat, just swish around in the mouth, maybe 2-3 minutes, and then spit it off. This practice also prevents the entry of the foreign bodies from this oral route. So this is another advice we have suggested. We also suggested if somebody has a sore throat or some kind of little cold, so they should do some inhalation of steam by fresh pudina leaves or fresh mint leaves or fresh ajwain, crushed ajwain seeds. And then it is so simple. 2 times a day one should do this. We have also advised to use, you have mentioned about the kada, and this kada is, it is very interesting, very tasty. Actually, this kada can be taken as a replacement of tea also, because it is so tasty. So it's like made with pinch of black pepper, 1/4 teaspoon of ginger, 1/4 teaspoon of powder of dalchini, and if you have fresh leaf, then 15 to 20 fresh leaves of tulsi, or dry tulsi, powder of 1/4 teaspoon together, and then crushed munakka or raisins, into this decoction, and then make a decoction like a chai, like we prepare tea at home, putting 1 mug of water and then boil it. And after boiling this, you just, one should strain it and then add some lemon if you wish, or some jaggery, but not honey, and take it as a tea and couple of 2-3 times a day. This specific formulation improve the immunity to the respiratory system. So respiratory is most vulnerable, and digestive system is also most vulnerable for these types of new virus infections. So it's like more of a preventive thing, more of immunity promotion thing. That is also we have advised, and we also advise to do some pranayama, yoga at home, keeping ourselves healthy, keeping ourselves busy, sleeping regularly, eating regularly. Those are the simple things. You may agree with me that nothing is complicated.
Agree with you, sir. And sir, whether these guidelines you have taken them globally?
Actually, it is interesting that we have translated this into 8 foreign languages, including 5 UN languages, plus German, Japanese, and Arabian. And these 8 languages we have circulated through social media, and we have also disseminated through our Minister of External Affairs channels.
And how is the response, sir?
Great. You won't believe. I'm getting feedback from from the real people, feedback from our missions, feedback from the world media. That world media is publishing this, and people are happy to to take those things, and so this is also one of the battery, or one of the area what we want to study, that after the issuing this guideline, roughly how many people did this, did follow this, and then what is the outcome that we want to study in next few days.
So, sir, I work for Ministry of Human Resource Development. I work very closely with All India Council for Technical Education, UGC, and we have students in engineering, pharmacy, management. So how these youngsters from technology stream can actually work closely with Ministry of Ayush to create something which is currently non-existent?
Actually, what we have, we are active participants of hackathon.
Yeah.
We have, and this through hackathon, in last 3 years, we have got more than 15 such great ideas, and it is under the implementation. We have also started an incubation center at our All India Institute of Ayurveda in Delhi, the first of its kind incubation center, and we want to spread across the country. So the startup people, the entrepreneurs, the engineering students, the pharmacy students are welcome to come here at this incubation center and work for the country with their new ideas. It's always welcome. This is first thing. Another thing is that we have visualized a big project of Ayush Grid. Ayush Grid is like a kind of initiative of creating IT backbone or IT solutions for everything related to Ayush. So, and then it is an advanced stage. I want to give you an example that we have created an Ayush-based hospital management information system, AHMIS, which is very robust. Now it is in pilot. We did all security thing, and it has a simple documentation system with outcome parameters. And what we did is very interesting, that we have connected it with morbidity codes, which we are working with WHO. And this in WHO ICD-11, there is a traditional medicine chapter. So WHO is ready and working with us to put these morbidity codes into the ICD-11. So you can see the potential that once HMIS is launched countrywide and everybody is used to use this solution, then at any given point of time in any year, we can generate data of 50 crore patients, which is now taking help of Ayush. And it is captured as per the WHO standard, and then big evidences are generated from big data. So that is what we are dreaming. So this is one small example of Ayush Grid, and there are a lot of verticals. So I invite these entrepreneurs, new generation students from all different streams to help us for this effort. It's a Herculean task, and everybody is required. So this is my call.
So, sir, we will close down on this very optimistic note. Like yoga, we also believe that this COVID crisis will prove as a boon for our Ayurveda to grow globally, sir.
Absolutely.
And sir, so really, thanks for sparing time in spite of your extremely busy schedule. We hope that more and more people in this country follow Ayush practices. Thank you, sir. Thank you very much.
Thank you. Namaskar.